Thank you very much, Dr. Ajai Kumar, for being with us here on NDTV Profit. Good to have you on the show today. Firstly, tell us, tell the viewers as to what exactly is your company all about. What do you really do?
We are a specialist in two sections in healthcare. In oncology focus, providing comprehensive cancer care across the country. We have now 14 cancer centers, comprehensive centers with a center of excellence in Bangalore and 12 new comprehensive cancer centers coming across the country. Our vision is to make cancer care accessible across the country with good outcome. This is how we have grown over the last several years to be one of the leaders in cancer care provider. Apart from that, we also have another division of under Milan brand name of Fertility. We understand fertility is also a big issue in India. With that, under Dr. Kamini Rao, we have now created this fertility clinics across the country. We have 5. We soon to have 8, and that will also be growing. So we have 2 main verticals which have very good growth opportunities in a country like India, where there is increasing number of cancer patients who need accessibility and good quality of care, as well as fertility centers.
So that's a little bit of background as to what your company really does. 2 major areas, of course, as you mentioned, that you really focus on. Now, with this particular IPO, how much of the capital are you looking to raise? What are your plans? Why did you really decide to hit the IPO or take the IPO route for this one?
We have had private equity investors in terms of Mr. Premji, Government of Singapore, Temasek and Quadria. We are now for several years, we are looking at further growth and actually listing to make sure that the public also become shareholders of this growth company. The company has grown over 25% in the last several years, and we see a future growth, significant growth, particularly when you look at the new cancer patients which is going to come, and ourselves seeing 37,000 new cases. When the 12 new centers are completed, we expect to see nearly 90 to 100,000 new cases, which will be a significant growth for us. So we want to naturally make public as our shareholders and participate in the growth of this. We are raising about 650 crores, out of which 250 crores will be primary and the 400 crores will be the secondary. And we intend to use this second primary for reduction of our debt, as well as further capex for our growth and also investment in IT section. We also have good anchor investors now with groups like International Finance Corporation, Harvard, as well as Nico and Sundaram. They are all in the anchor group. So we have a solid anchor group. Because of that, we look at long-term investors to participate in the growth of HCG as well as Milan.
All right, and we also understand that through this issue from the anchor investor side, you've already raised about 292 crores, and that too at the higher end of the price band. Talking about the 250 crore and the debt that you will be paring through this amount, could you tell us as to what is the total debt that your company has right now? How much are you likely to reduce it to?
We have 2 kinds of debt. One is the bank finance debt, which is at an interest rate of 11.25. We intend on retiring that most of the debt. So it will be in the region of around 150 to 170 crores what we will be retiring. And we also have a vendor finance debt, which has a long-term deferred plan. Because of that, we don't have to pay interest or principal for 3 years. So with that, our main focus now is to retiring the interest-bearing debt, as well as some of the capex requirements. And as I stated, we believe investment in IT infrastructure is very important for cancer care, to make sure we collect the data and we look at the outcome, as well as integrate with SAP to see that all the centers as they grow, they are monitored centrally and they have a good growth opportunity as well as good quality outcome for our cancer patients. Ultimately, the whole focus is on our cancer patients to make sure their outcome is equal to the global standards, and that is what we have achieved very clearly. And we have been quoted several times in the Harvard Business School and also in the Harvard Business Review on these aspects.
Right. So that's about the, primarily what the company does. We've also understood how will you be really using these proceeds. We haven't touched upon the expansion part or where you will be putting in money to expand further. But looking at your financials at this point in time, your bottom line has been in the negative. You've been posting a loss, though that has narrowed down if you compare it on a yearly basis as per the numbers that we have for FY15. Give us a sense on that front. I mean, what's really been happening? What's the reason?
If you take a step back, we have always been EBITDA positive. Our growth has been solid growth in EBITDA. Last year, in FY15, we touched 81, and we are on track to achieve our goals for this coming year. We believe our margins on the mature centers we look at, EBITDA margin is actually 25%. Our ROCE is also high at 29. So we are on track to achieve these goals. As and when the centers become mature, all of them will become high EBITDA margin with good ROCE. This is our way of, the growth happens, the centers become mature and produce high level of profitability.
Okay, and what are your targets going forward as to how much of a growth can we really expect on the top line as well as on the bottom line? And what is the total amount that you're looking to invest for expansion within the year the next financial year?
I cannot do any forward-looking comments, but at this time we are going to, we'll be generating good amount of cash flow coming year because of our increasing EBITDA and increasing margin. We intend on using this for further expansion, not only in India, but we also have made some inroads into Africa because of the number of international patients we see. Nearly 20% of our revenue in Bangalore comes from international patients, and it is going to increase substantially as we go forward. And we are also established some clinics in East Africa. We are working with Commonwealth Development Corporation, where we have formed a JV to expand this further in few selected cities in East Africa. Well as we see number of opportunities in India apart from the 12 centers, where we are looking at opportunity to expand probably in areas like Punjab and northeastern part of India, where there is a significant need.
So you will not, of course, be stationed in Bangalore. You've got plans to reach out to the northern part of the country very soon. How soon can we expect any target that you can share with us?
Pardon?
Any targets that you can share with us?
No, at present I do not like to comment on the future.